AM 1450, FM 99.3, KNSI. Welcome to Your Health, a brand new program that features local health experts from CentraCare, and I stress that word local because these folks are your neighbors. They're the folks that you see all the time at the kids' schools, the grocery store, living, working here in central Minnesota. And that is important because they know firsthand about the health issues that affect you because they are also impacted by those same factors. They just happen to be healthcare professionals at CentraCare. And today we welcome Dr. Sean Wherry, Family Medicine. Good morning, sir. Great to have you.
Good morning. Happy to be here.
When we say family medicine, doctor, what does that all encompass?
So family medicine is basically your old-time general practitioner. So we take care of pretty much everything and anything. So cradle to grave, pediatrics, youth, adults, and elderly. So it's a wide breadth of primary care, basically.
Sure. Is that one hat or a whole bunch of little ones?
Whole bunch of little hats. So a lot of my days typically changing hats from patient to patient, from room to room. So a guy with a great ADD like me, it's a fantastic career, and it's really rewarding. So you get to be a part of the community, you really get to take care of your neighbors, and it's kind of the perfect type of medicine for me. So
you know what I think is really cool about that is literally you will be taking care of people from the cradle to the grave.
Absolutely,
awesome.
Absolutely, and we I have patients who, deliver babies, and we take care of those babies. Yeah. We've taken care of the moms throughout their pregnancies. We're taking care of their grandparents as they age and kind of transition to other forms of care. And so it's a fantastic field.
Well, I don't know if you've noticed this or not, but it's winter right now.
It is.
It is. And winter brings with it some rather common health conditions that affect pretty much everybody. Mm-hmm. What are you seeing right now the most of? Is it kids? Is it flu? Is it runny noses? What have we got?
We're seeing a combination of stuff. In terms of the acute stuff, infectious diseases right now, we're seeing a combination of influenza. Kind of nationally, we're seeing kind of high activity across the country, though it's maybe tapered off just a little bit here in Minnesota over the last week or so. A lot of viral things. So upper respiratory tract infections are probably one of the most common things that we see in the healthy population. So these are the viral colds, start out as the sniffles, end up congestion, runny nose, cough, things along those lines. So we're seeing that pretty frequently, but we are still seeing a little bit of influenza as well.
Well, speaking of the influenza, the vaccine matched up pretty well this year, did it not?
It did. And I mean, certainly compared to the last several years, it feels like we are seeing, just at least anecdotally in my experience in clinic, we are seeing fewer cases of influenza, and the ones that we are seeing, patients seem to be tolerating it a little bit better than the last several years. So.
Good. Now, as far as influenza goes, there are some people who should not get the shot. There are those who should be vaccinated. Can you address that, please?
For the most part, and really I'd have you talk with your primary care provider to see who should and should not get the vaccine. Right now, we are trying to vaccinate as many people as we can because the potential consequences of this disease is so significant, particularly for kind of like the vulnerable patients. So we're talking about children over the age of 6 months, patients over the age of 65, patients with other what we in medicine call comorbid conditions.
Sure.
So heart disease, lung disease, things along those lines.
Some other outlying factors.
Women who are pregnant, women who are postpartum, also are at higher risk for complications from influenza, and oftentimes in those patients as well, a lot of the protection that the infant is going to get is going to be via the mom's immunity. So those are the populations that it's very important that we vaccinate. But I'm still very pro vaccination.
Sure.
I think almost everybody should get it as long as they're cleared to do so.
So we were talking about the fact that it is winter and it presents itself with all sorts of diseases, if you will. Do you think that because we had this really cold weather and it forced schools to be closed, the snow, all that sort of thing. Do you think that has had a positive impact on the influenza outbreak here, if you will, in central Minnesota?
Potentially. I mean, I don't know if it has been measurable, but it certainly seems reasonable to me. It's a communicable disease, meaning that, the more you're in public, the more you're close to patients who are other folks who have the disease, the greater the chance of you obtaining it. And so, periods of time where we're, not in classes, not in church, things along those lines where we're not as close to people, we may have a little bit of decreased rates of transmission. Conversely, the other thing is as we move in, more indoors and we think about, some of the reasons people theorize why we have cough and cold season typically in the winter is now we are indoors, we are closer to folks, and that transmission so that is a little bit easier just because of the proximity. And there's also, with influenza in particular, there is kind of this annual pattern to it as it moves geographically across the world. So and then for North America, particularly in the Midwest, it hits wintertime.
Right.
As we move further to Alaska, West Coast, and stuff like that, it actually moves a little bit later. And we actually, from an epidemiology standpoint and a public health standpoint, we'll actually vaccinate a little bit later in the year as we kind of move further west to try and trail that virus as it moves. So it's just kind of interesting. But
yeah, no doubt. Flu germs don't like 30 below zero either, do they?
They don't. I think everybody tries to stay inside at that point. So.
Well, very good. Very good. We are talking with Dr. Sean Wherry, family medicine practitioner at CentraCare Health. Now, your wife is also a doctor, correct?
Yeah, she's a family medicine doctor as well, yeah. So,
where do you guys practice?
So we practice out at the CentraCare St. Joe.
Okay.
And so we've been here it'll be 3 years in July. So we trained together and have practiced. I graduated from med school in 2006 and have been practicing together ever since.
Conversations around the Thanksgiving table must be a little interesting.
And I would say our kids have kind of a different view of medicine and anatomy, and occasionally we'll get some complaints from daycare providers that our kids are using anatomical terms to describe certain things rather than
the words are too big.
Yes. So.
Well, Dr. Wherry, thanks. We're going to take just a quick break. When we come back, we'll pick up our conversation right where we leave off, talking about winter problems, whether it be the common cold or if it is something as serious as the flu. How do you know when it's time to go see Dr. Sean Wherry? AM 1450, FM 99.3, KNSI. We'll be right back. AM 1450, FM 99.3, KNSI. Back with Dr. Sean Wherry, do I call you a family medicine practitioner? Is that right?
Sure, yeah.
Okay.
Yeah.
With CentraCare, he and his wife practice over in the St. Joe Clinic. And it's so important that we talk with local physicians because these are the folks that you see each and every day, as you know, and they are going to be experiencing the same issues that you are, very familiar with what's going on in our community, which is why we do this program called Your Health. Dr. Wherry, what about some of the symptoms that moms and dads may or may not think they're serious enough to come see the doctor? How do we know?
Sure. Well, I like to kind of take a step back and talk about influenza or flu to begin with. Okay. Flu is probably the most significant viral infection that we're seeing in the community right now. Flu to a lot of patients, and to myself prior to becoming a physician, often meant stomach flu,
right.
So nausea, vomiting, things along those lines. But it's important to understand that when we're talking about influenza, what we're actually talking about is a respiratory disease rather than a gastrointestinal disease.
Sure.
So flu is going to be much more analogous, though much more severe, to the common cold.
Okay.
Now, the difference between the two, flu oftentimes, when I talk to my patients and I'm asking them and trying to ferret this out, I'm saying, all right, how long did it take you to get sick? Right? Do you feel like you were hit by a bus? Flu comes on very, very quickly, and is often associated with high fever. In medicine, we have to use big words because we like to talk about how smart we are and stuff like that.
Sure.
But we say malaise, which is just, the feeling of yuckiness, basically. So high fever, yucky feeling, achy body, may have a significant cough, oftentimes has a headache, things along those lines. The cold or the cold virus is what we call an upper respiratory tract infection. So it usually kind of starts, you can almost think of it as starting at the top of your head and kind of moving down.
Right.
May start with feeling a little yucky, runny nose, maybe some sneezing, increased congestion, some ear congestion, things along those lines. And then you'll develop a cough as well. But usually what's absent is going to be the high fever. Mm-hmm. Usually the significant amount of body aches and the significant amount of just general fatigue and things like that is not going to be present in a cold. And the speed at which these symptoms develop is usually over a longer period of time.
You feel it coming on if it's just a cold.
Yeah. Flu just hits you and knocks you, knocks you down. So.
Okay, what is the time frame that we're talking about here? Flu is going to linger for how long as opposed to the common cold?
It kind of depends upon
the individual?
On the individual, on their other health problems. The flu in general, if we don't treat it, and we do have a window to treat and kind of change the time frame, but if it's untreated, typically 2 weeks is
really
is
that
common.
Long.
Yeah. Now, an upper respiratory tract infection also can last a decent while as well, but more often, you're going to be closer to that 7-day mark where where the symptoms have kind of peaked and you've started feeling better.
Sure.
However, it's not uncommon if somebody has a good upper respiratory tract infection with a cough, for instance, that even that tickle cough can really linger on for up to a month. But in the absence of fevers, chills, worsening symptoms, generally those people are feeling better. They just have kind of like this annoying cough that holds on.
Sure.
Both of them, can last a bit of time because you have this inflammation that remains after the initial infection.
Okay.
But by far, the influenza typically seems to last a little bit longer in terms of the significant symptoms.
Well, what about that stomach bug? What is that called these days?
So that's viral oftentimes as well. And actually, we have been seeing a little bit of a gastroenteritis going around as well. So those could also be quite infectious. You hear the horror stories of the Norwalk viruses and things along those lines on cruise ships where
the whole thing
ruins your vacation. Those we are seeing as well. The stuff that we've been seeing most recently has generally been lasting 24 to 48 hours or so in terms of its significant symptoms, and then kind of resolving on its own.
Well, what about remedies at home? I mean, other than going to the doctor and getting medicine, is it just like Mom always said, drink plenty of fluids, here's some chicken soup and all that kind of stuff?
Yeah, it's fluids, rest, listening to your body. So the old adage of feeding a fever and starving a cold and stuff like that. Never great evidence for that. But if you're hungry, eat. If you're not, just listen to your body. A lot of, particularly with respect to the common cold or the upper respiratory tract infections, there are a lot of over-the-counter medications. There's not great evidence that any of those are really going to do anything. Certainly, they're not going to speed the resolution of the symptoms, but they can sometimes help you feel a little bit better temporarily. Now, we do recommend that children don't use the over-the-counter medicines with respect to multi-symptom relief, and part of that is because the evidence right now doesn't suggest that it really does much. And so, the thought is, why do we want to put a pediatric patient at risk for a medicine that's really not going to change the course? But the ones that we do use often that do seem to at least help people feel better would be things like Tylenol and ibuprofen or Motrin, both which take away aches and pains, swelling, and fevers. And then for adults, and as we move kind of closer to those sinusitis, those sinus infections and things along those lines, some of those decongestants, there's some evidence to help keep people from seeing me, keeping people from needing antibiotics and things along those lines.
Saline spray works awesome.
Yeah, fantastic. If you can convince somebody to do it, the saline rinses I think are great, but there's
I'm not doing the neti pot.
Yeah, there's a little learning curve over there. You got to learn not to shoot it down the back of your throat. But it works great, and a lot of times people are looking for these non-medical ways of trying to manage these things, and I think saline sprays, the neti pots, and the saline rinses work well from that standpoint.
What about things like, and I'm asking you this because I'm a fan. I've become a fan of Airborne. Okay, it's got a lot of natural things, echinacea, zinc, magnesium, all that stuff, but ultra high doses of vitamin C also. What do you think of those?
Not great evidence when we look at the literature for those. I mean, certainly the stuff that is in those is typically going to be safe if your body's not going to use it, particularly like vitamin C.
You're just sloughs it off, right?
Yeah. So I don't think there's great evidence for that. There is a little bit of evidence for zinc, but again, it's not fantastic.
Sure.
I mean, if somebody were sitting on the cure for the common cold, we would hear about it by now.
I guess.
So I don't think you're going to do any big harm. Some of the zinc solutions you do have to be a little bit careful about because some of them can have some side effects. I think Zicam used to have kind of a nasal version that I don't think they have anymore because it actually caused what we call anosmia or lack of smell.
Okay.
But most everything, like I said, is probably safe, but probably not super effective.
Kind of important to make sure that you're drinking plenty of fluids, though, right?
Yep. You got to understand that our body is designed to fight these things, and you got to give it the ammunition to do that, and that's going to be predominantly fluids and rest. So not allowing yourself to get too run down, and then making sure that you're staying well hydrated.
Talking with Dr. Sean Wherry, family medicine practitioner for CentraCare. He and his wife both practice over in the St. Joe Clinic. I tell you what, I want to switch over to some old-fashioned wives' tale remedies, that sort of thing. Get that mustard plaster out, right?
Yeah.
We're talking about the common cold, influenza, and maybe some norovirus issues as well. The program, my friends, is called Your Health with CentraCare, AM 1450, FM 99.3, KNSI. AM 1450, FM 99.3, KNSI. Welcome back to Your Health. And my friends, this is such an important program, I think, Because we're talking with healthcare professionals at CentraCare who are actually from this area. They live here. They know what they're seeing. They know what's hot at the clinic right now at CentraCare. And it's just important, I think, that we keep all of this information local and to keep you on top of your health. After all, Dr. Sean Wherry is our guest. And Dr. Wherry, we mentioned that we're going to talk about some old wives' tales, some of those old family remedies that have been came over on the boat with my great-grandma.
Yeah. So, a lot of the old wives' tales, again, have either not been looked at significantly from a research perspective, or if they have, there's not a lot of great evidence for them. Generally, it's the stuff of staying healthy, resting, getting chicken noodle soup, getting your fluid in, things along those lines.
Yep.
There was, one study, and it was funded by, I think, like the Honey Producers of America or something like that. So take it with a grain of salt. But there was one study that looked at parents giving children who are old enough, so typically over the age of 1, a teaspoon of honey before going to bed, and that reducing nighttime awakenings associated with cough.
Well, and then speaking of honey, if it was locally produced, right, that's supposed to cut down on all the allergens?
Yep, kind of exposure to those allergens that are found in the local area, kind of like exposure therapy, like if you were to go to your immunologist who gives you kind of graded exposure to allergens, kind of the same thought.
Earaches. Heard anything about earaches, old wives' tales? Because I can tell you what my mom used to do for me.
Yeah, tell me what you did. Because there was a fantastic medicine we used to use, and they took it off the market. So there's for earaches, a lot of times what we end up using is Tylenol and Motrin anti-inflammatories. Of course, with an earache with a fever, particularly a kid, we want to take a look in that ear and make sure that it's not brewing ear infection that would require antibiotics. Okay,
this is going to be awful then. So my mom was a smoker. So she would take a big drag off that Lucky Strike and then exhale that smoke in the ear, right? Because the warmth would be in there. So I'm telling my daughter this, who's involved in the healthcare field down in Rochester, and she goes, "Dad, don't you know that brings on ear infections, or it can?"
It does. Exposure to cigarette smoke from kids can actually increase rates of ear infections and asthma and things along those lines. And the important thing about that is it's not just direct smoke. So it's not just
right. It's the
smoke.
second.
The parent who is trying to do the right thing, smoking in the garage and keeping the smoke away from kids, that exposure can actually cause increased risk of ear infections and asthma as well.
Well, then, don't smoke, folks. Yeah. You had mentioned the word prevention, and it doesn't matter if you're a child in the middle of your life or toward the tail end. Prevention is really worth a pound of cure here, isn't it?
Absolutely, it is. And particularly with a lot of these diseases that we're talking about now, which are viral, there's very little we can do to expedite the resolution of symptoms. And so trying to prevent that is our first line of defense. And so, that comes in the form of vaccinations when available. It comes in the form of just general practices. So if
washing
you're sick,
your hands.
If you're sick and you're having a fever, not going out, not going to school. If you're coughing into your elbow rather than in the hands. Things along those lines. So it seems that it should be self-evident, but these communal health things that help help stem the spread of some of these diseases. So
well, and we both mentioned chicken soup, and if I understand it correctly, just the warmth going inside your body does a wonderful thing. You've got liquid plus mom is there, right?
Absolutely, getting taken care of you. Warm showers is another great one. Sometimes can help loosen up some of that phlegm in those upper airways and get some of it moving out and things along those lines.
Well, Doc, how do we know when it's time to really come see you that it has gotten bad enough I have to go to the doctor?
Well, so a couple things. I mean, initial caveat is that if ever you were concerned, I want you to come in and see me. Part of my job is education in the exam room as well. So anytime that a patient is concerned that they've been sick long enough, I put a lot of stock in kind of a parent's assessment of their kids. If they get a funny feeling about the kid, I want to see that kid. Yeah, they know normal with those children. In general, typically high fevers is a time that we want to see
like
folks.
A long time, a day or two?
It varies, right? Okay. So when we're talking influenza, particularly in a healthy population, we only have about 48 hours after the onset of symptoms to really make a significant change in the duration with the use of some of our medicines. So high fevers accompanied by significant body aches and things along those lines that were rapidly onset we want to see them relatively quickly. Now, certainly anything where we're having, any evidence of shortness of breath or increased work of breathing, you're looking at a kid and they're, you see their belly going up and back. Yep, they're using those muscles in their neck to help breathe. Same thing in adults. Those are all reasons we really want to see them and make sure that they're doing well from a respiratory standpoint.
Yeah, and again, some underlying symptoms, asthmatics, holy cow, don't let that go, right?
No, and particularly with children because they have such a great reserve. When they kind of go over that edge, they go over quick. So we want to see them pretty quickly. A lot of times when I actually see people is usually when they're just sick and tired of what's going on. So it's usually 3 to 5 days into an upper respiratory tract infection.
Sure.
I just want this to end, and I sympathize with them. I want it to end too.
Well, what about things like the Quick Clinic, e-clinics, going to the urgency center, all that kind of stuff?
So we've got kind of a cool system set up here in St. Cloud through CentraCare because we do have a lot of options for care. Kind of the front door to it, I would say, would be the CentraCare website or the CentraCare
MyChart?
Yeah, MyChart or CentraCare Connect.
Okay.
So we have a CentraCare Connect is a 24-hour service where you can communicate via text, phone, and I believe computer as well. Most folks do it through the phone, but have access to both schedulers, so you can make an appointment. If you wake up at 2 a.m. and want to see your doc, you can call and make an appointment.
Okay.
But more importantly, we have nurses who are on duty, and these nurses are trained in triage, and so part of their job is to say, to talk to you about your symptoms and say, all right, how long has this been going on, to see, all right, what's the most appropriate level of care for you? Now, it may just be home care. So, kind of like the old country doc, you'd call them up on the phone. They say, take 2 aspirin, call me in the morning type of thing. Well, now nurses are doing that for us. And so they can give home care, home instructions, and can kind of direct people to what level of care may be best suited for their needs. And again, we do have a lot of levels of care here, and some with a little increased convenience in terms of access, like the e-clinic and things along those lines, which is open 24 hours a day. So they're probably the best way into that system, I think.
Well, Dr. Wherry, in closing, how about listen to your mom, wash your hands, and all of these things that you've always heard? There's something to it, isn't there?
Absolutely to that, yes.
Appreciate your time today.
Well, I'm happy to be here. Thank you for having me.
Dr. Sean Wherry, family medicine practitioner with CentraCare in St. Joseph, AM 1450, FM 99.3, KNSI. Again, this is Your Health, a brand new program here on KNSI designed specifically to address local health issues with local healthcare professionals from CentraCare. I'm Bob Hughes, AM 1450, FM 99.3, KNSI.